Hey, what's up you guys? My name is Buck Parker. I'm a board certified general surgeon, and in this video we're going to talk about gallbladder surgery, also called cholecystectomy or laparoscopic cholecystectomy. Okay, so in my other videos I kind of went over why we get gallbladder disease and kind of the symptoms and the pain and all those things. But in this video I want to talk about specifically the surgery and, well, basically the treatment. So there's a couple different reasons that we do gallbladder surgery, and one, okay, I'll talk about is, we'll just list a couple here, and I'll say recurrent or symptomatic biliary colic. And that's just when you have gallstones, right? We had gallstones in this little gallbladder here, right? And they get stuck in the neck of the gallbladder can't get them out, or then it gets kicked out and your pain completely goes away, you're completely resolved. But if you get that over and over, then it could lead to other bad things such as acute cholecystitis, gangrenous cholecystitis, gallstone pancreatitis, which I haven't talked about yet, but we'll talk about that later. Okay, so recurrent or symptomatic, we'll call it symptomatic, and there's a reason I say symptomatic, biliary colic, okay? Chronic cholecystitis. And this is kind of, biliary colic, chronic cholecystitis are similar, but you may have some evidence of chronic cholecystitis on like an ultrasound or a CAT scan or something like that. Third is acute cholecystitis, and this is an infection of the gallbladder, okay? And I mean, there's other ones called gangrenous, of course. Gangrenous, real bad. Sometimes we don't know. We can just say that, beforehand, we'll say it's acute cholecystitis, and then we go in and say, oh, the gallbladder's dead. Hello. Hello, dead gallbladder. Cystitis, okay? So for these reasons, your surgeon / doctor will recommend you have your gallbladder out. So there are a couple different ways we can do gallbladder surgery. The most common one right now is called laparoscopic cholecystectomy. Okay? And that means what we do, I'm going to take all these and I'm going to put them over here actually because it's better, and I'm going to use this. So, and that means what we do is, this is my little famous drawing here. This is the belly button, this is the rib cage, this is the groin crease, okay? We make an incision, which is about 12 millimeters right here. We make another one about 5 millimeters. Let's say I make 12 millimeters, 5 millimeters, 5 millimeters, and 5 millimeters here, okay? And we put a camera in like this. I say that because some people kind of do a 12 here and a 5 here and a 5 here and a 5 here. So that's a little bit different people, it's fine. So we put in a camera, okay, right here. We put small instruments in this way. The gallbladder lives about right there, and we go in and we take the gallbladder out. So we see, obviously, we have a TV screen over here, which is showing us the picture of what's inside. And what we end up doing, let's move over to this little drawing here. Well, we come in and we get, this is called the cystic duct right here, and we clamp or clip, actually put a couple clips there, go in there, and then we'll cut the cystic duct right here. And we'll take this, which is the gallbladder, and then put it in a little baggie. We'll do a little baggie. We'll pretend this is a baggie. Okay, we'll put it in the baggie and pull it out through the incision in your belly button. There is also an artery there. It's called the cystic artery. We clip that as well. And the gallbladder is actually attached to the liver. So we peel the gallbladder off the liver using some electrocautery, and then put it in the baggie and pull it out through your belly button. And that takes, I would say, like on average, because some of them are really quick, it's like 16 minutes, and then some of them take longer, a couple hours. On average, it's an hour surgery, okay? For non-complicated gallbladder disease, like you had some biliary colic here and there, it's not that inflamed, it's not a big deal. You'll be maybe a half an hour surgery. If it's recurrent, and it's really bad, and it's been 10 years, and you have this pain for 10 years, and it's really scarred in, and then it could be longer. If it's acute, like there's, it's infected, it's bleeding, all that stuff, it could be, longer, couple hours, 2-3 hours. Typically, they're not 2-3 hours, but on average, 1 hour could be plus or minus, okay? So the other things I like to talk about are potential risks of the surgery and the options, okay, if you want to say options, of not doing surgery, okay? So what I think you can do, and you can break them up into categories of non-infected, okay, and then infected or acute cholecystitis. Okay, so the non-infected, what are your alternative if it's not infected? Well, you can just do nothing essentially, okay, and you can improve your diet. So we'll say no surgery, and it would not require antibiotics. No, I write antibiotics like that, and then diet modification. And diet modification would include things that do not stimulate the gallbladder too much, which would be fats, so dairy, fried foods, hamburger, all the fun stuff to eat. You can't eat any of that, or you'd have to minimize that, because when you eat that stuff, then the gallbladder is stimulated to squeeze. If there's stones in there, which I'm assuming, if it's not infected, if you have cholelithiasis, which means you have gallstones, and you start eating dairy, fried foods, hamburgers, cheese, all that good stuff, and that squeezes, the gallbladder squeezes, kicks the stone out, you're gonna have the pain. So that's why you say this is the alternative to surgery. Okay, so if you're infected, now you could, I don't recommend, but you could just do antibiotics. Okay, and that would require in-hospital antibiotics through the IV, and wait. But the problem with this is that you still have the stones. Once the infection clears, you're at risk again for those stones to block the neck of the gallbladder, and in fact it may stay blocked, and then you may have more problems after. Now, the other thing that people ask is, can I have some kind of ultrasound and break up the stones? And you can, but the problem is that your body makes these stones, and it's going to continue making these stones. You break the stones up, and then you're going to make more stones, and then you're going to have this problem again. So that's why we usually recommend that it comes out, and it's a pretty safe operation. It's one of the most common operations we do, especially general surgeons. And so most people do very, very well with that. And so that is basically your alternatives to that. Now, the other thing I like to talk about is the risk of surgery, because everybody should know the risk with surgery. There's risk with any surgery. The number one risk with surgery are bleeding and infection. Number 1 and 2, I mean. Okay, and these are probably less than 1%. This infection depends on if you have an infection already. If you don't have an infection already, you're less than 1%. If you do have an infection, as you have acute cholecystitis, you're gonna be higher. You're gonna be like 5 to 10, even to 20%, depending on the risk of infection, okay? And then the third one is bowel injury, and you can just lump that into injuring something else besides what we're in there for, because we're going in there, sometimes everything is stuck together, we have to peel things apart or whatever, and you can always injure the small bowel, not really the esophagus, the stomach, the small bowel, even possibly the pancreas, although unlikely, the liver, and the bile ducts. And the final one is what I like to talk about, is because it's very specific to the surgery, is the bile duct injury. And this is specifically the CBD, or the common bile duct, which is this main bile duct here. If you have that injury to that, if it's all scarred down and you can't tell what's what, and it's all stuck together, and you peel the gallbladder off this stuff, and then all of a sudden there's lots of bile everywhere, and the common bile duct is injured. In all gallbladder surgeries across the United States, it is 0.05% of a chance of having a bile duct injury, okay, of all surgeries. That means all the easy ones and all the really, really hard ones. So if you have a really bad infection, or it's been 10 years or 20 years and you've been having this pain, then you're at a higher risk. If you have, it's only been a couple months and it's not inflamed, it's not infected or something like that, then you're a much lower risk than this 0.5. So the other thing is with the bile duct injury, what ends up happening is you can no longer do this laparoscopically, and you have to do it what we call open. And essentially, I showed you the other incisions. They were kind of here, here, and here. We end up connecting the dots, make an incision bigger, and so we can go and hand sew these things back together. So that's the biggest risk, I think, as far as like altering everything else. With a regular laparoscopic surgery, you're in the hospital maybe for 24 hours or something, and this one you're going to be 3 to 5 days, and especially it could even be more. And then down the road, you could have other problems related to this common bile duct injury. So that's the big one. Nobody wants to talk about that, but I definitely make sure that I let everybody know about that before their surgery. It's just one of those things. We always say, if you're going to play football, you're going to get tackled. You're going to do surgery. Things are going to happen. They're going to be unfortunate. They're going to be, complications are going to happen. Unfortunately, they do happen. We try our best not to do that, but that does happen sometimes. So the last thing I want to talk about after surgery, about the surgery, is after surgery is the recovery and what's the deal with the recovery. Everybody wants to know, when can I go home and stuff. So recovery from cholecystectomy, laparoscopic, also laparoscopic, is going to be 24 to 48 hours in the hospital, okay? Now this is if it's infected. If you come in, you're sick, you're infected. So let's say acute. So this is acute. And then you can have it done outpatient, which means you come in the morning, you go home in the afternoon. And this means, and you can have it done outpatient, which means you go home, or you come in the morning, you go home in the afternoon. And this is if you just have cholelithiasis. What did I say? This is just if you have cholelithiasis. Okay, and there's no infection, things like that. So you can go home the same day. Now, recovery at home, I usually tell people, stay home for a couple days, take some pain pills. You're probably going to be a little bit sore, but in 2 to 3 days, you should be getting up, and in 2 to 3 days, you should be feeling pretty normal. You can do things around the house. You can watch movies. You can read. You may even be able to go to the grocery store within that first 2 to 3 days. But you just got to take it easy, okay? After about a week, you feel really good. You forget you had surgery until you twist the wrong way. Usually that belly button incision lets you know that. And then I tell people, no lifting over 20 pounds for 4 weeks. That's the average, I tell people. So if you're younger and you're healthy, maybe 2 weeks. If you are older and you've had, you're a smoker or you have other complications, then maybe I might say 6 weeks. So it depends on the patient. So that's, and the last thing is the diet. There's no change in diet post-operatively. Diet, no change. Nobody wants to change their diet, and they always want to know, do I have to eat something different? You don't have to eat anything different. Now, the reason you have the gallstones is usually because you're having too many hamburgers and stuff like that, but you're not going to get gallstones anymore. And finally, people always ask me, how do I live without my gallbladder? Can I live without my gallbladder? And the answer is yes, of course. We do it all the time. What ends up happening is the bile trickles down the bile tubes in a continuous fashion, and it trickles out of that sphincter. It overcomes the pressure of that sphincter, and it trickles into the small bowel. So what you end up having is a change in the concentration and the timing of the bile. And eventually your body gets used to that. And sometimes people have diarrhea. Typically they don't have it for more than a couple weeks. Every once in a while you see somebody that has it for 2-3 months, but then it goes away. So that's usually not an issue, but you do have a change in the concentration and the timing of the bile. So it might change your digestion a little bit and your bowel habits a little bit as well. Okay, so I think that's all I want to talk about with gallbladder surgery. I hope you got a little bit of understanding of what we do, why we do it, what the alternative treatments are, and complications and recovery. So if you wouldn't mind, I think you should like this video because it was super awesome. Maybe share it with a friend and subscribe to my channel. That'd be great too. And I'll see you in the next one. Take care.